Today marks the one-year anniversary of the first COVID vaccination in Thunder Bay. Since then, more than 270,000 doses of Pfizer, Moderna, and AstraZeneca have been given out in the Thunder Bay district. The rollout has been a monumental effort by local health officials. And it's not over yet, as booster shots are being offered help to prevent another wave of the pandemic. Danielle Bain has more on the past year of vaccinations.
To be the first person to get it was actually a great honor and pride.
1 year ago, Sean Bolton, a personal support worker with St. Joseph's Care Group, was the first person in the Northwest to receive the COVID-19 vaccine. The rollout started slowly, but before long, thousands of people were attending local vaccine clinics each week. Thunder Bay Regional President Rhonda Crocker-Ellicott remembers vividly what it was like to be able to start providing vaccines to the city of Thunder Bay.
I reflect back to this time last year and how anxious and enthusiastic we were to be receiving the first vaccines in Thunder Bay as one of those first hospitals to have the privilege of being able to roll that out to really give that layer of protection to initially to staff and then to vulnerable and at-risk patients. So it was really a privilege to be a part of that initial rollout and all of the enthusiasm and planning and that came around that.
The vaccine was eventually expanded to be available at pharmacies, and then last month, children aged 5 to 11 became eligible. So far, 30% of that age group has been given their first dose. After a year of clinics and appointments and encouraging the public to get the jab, District Medical Officer of Health Dr. Janet DeMille is happy at where the district is in terms of vaccine numbers.
It was 89.9, so I'll just say 90% coverage rates for individuals 12 years and older up for first doses. So I think that that's really awesome. And to think that nobody was vaccinated a year ago, we've come a long way.
DeMille added that despite the arrivals of COVID variants, there is evidence that the vaccines are working, and it can be seen in the spread of the virus in elementary schools versus high schools, as well as hospitalization numbers.
Right now, I also believe that there's only 2 individuals in hospital, whereas given our case numbers, I would have expected more if we weren't a vaccinated population. So I think, this is a real tool, a real benefit that we have as a community and as communities.
We're seeing booster vaccinations, the third dose of vaccinations, and early word with respect to the potential effectiveness of that against Omicron variant.
Both DeMille and Crocker-Ellicott are happy with the vaccination numbers over the past year, but want to stress the importance of getting a booster shot once eligible to help keep the city safe and to keep hospitals from overcrowding. Danielle Bain, TBT News.